Health officials in New York City are investigating a possible case of monkeypox.
Yeah, the announcement comes one day after a man in Massachusetts became the first person in the U.S. this year diagnosed with the rare disease.
A very alarming development. And to break this down, Dr. Jeremy Faust joins us now. He is an emergency physician at Brigham and Women's Hospital at Harvard Medical School, also author of Inside Medicine on Bulletin.com. Dr. Faust, thank you very much for joining us. Tell us first, what are the symptoms of monkeypox, and is this life-threatening? So many of us don't know much about it.
Thanks for having me. Well, the first thing to say is that very few American physicians or healthcare workers have ever diagnosed and treated this. So we are all learning this from our textbooks and from the experts who have done this. And what we will find out is whether the reality is what we've seen in the past. So you start to see very vague symptoms of viruses that are kind of similar to all viruses. That's frustrating because the fever, the body aches, the back pain, that kind of a thing is hard to suss out whether that means anything. But what becomes the hallmark of monkeypox, we're told, is that 1 to 3 days after all of that begins, that a body rash can occur and does occur, often starting in the face and then descending down, but we don't think that's universally the case. And the rash can start as sort of flat lesions, and then they become these sort of fluid-filled vesicles or pustules. And that's the sort of hallmark. If you Google search the images, that is what you'll probably see. Pretty alarming. So, and then as time goes on, this can become a very life-threatening illness in some cases.
So, doctor, what you described sounds a little bit like chickenpox. How can people tell the difference right off the bat? And tell us how contagious it is, because right now Spain, the UK, and our neighbor Canada are also dealing with larger numbers of possibly confirmed cases. So tell us about how contagious it is.
Well, the question of how contagious it is a little bit of an open one, because we've really never seen an outbreak that I'm aware of, just looking through the history of this virus, that we've tracked that has occurred in so many countries simultaneously. And that might just be bad luck, that the conditions are aligned that this is happening. We're a more global society, and we know that this travels very frequently in sexual networks. So that's one thing that's being looked at. So we don't know if it's more contagious or more transmissible. It kind of looks that way, but I think it's too soon to tell. And there's a lot of ways it can spread. I guess the open question is people want to know is, like, how contagious is it? Can I get it through casual contact? And historically, the answer has been that it's not so easy to get, that it takes sexual transmission or skin to skin. Now, in terms of chickenpox, very difficult. The one thing I'll say is, if you're not sure, seek medical attention. There's no Googling your way or out of this one if you're worried. But right now, the thing I would say is that epidemiologically, we're seeing this in males, which that's because of the sexual transmission piece. So right now, chickenpox would be something that we would expect to see in a very young, unvaccinated child or in someone who's supremely immune compromised. Neither of those really match what we're seeing right now epidemiologically, but we will see.
Certainly something to keep an eye on. And, the thing is, if something like this had happened perhaps a few years ago, people may not have paid as much attention to it. But after dealing with COVID now for more than 2 years, do you think that we as a country are better prepared to deal with this if it does become a larger outbreak?
Well, one thing I think we are a lot better at is data sharing, and people are a lot less sort of proprietary and kind of keep their data quiet and protective. We already are seeing Global Health, which is a data organization, just releasing an ongoing case count where they have symptoms and whether they're in the hospital and any information that's publicly available, so that we can all look at this fairly in real time. Even just in the past 12 hours, I've seen updates, and we now see more and more cases in more and more places. So I think that one thing that the COVID pandemic has taught us is that it's always better to share data and that we learn a lot from each other. In terms of systemic readiness, I think that on one hand, we have fatigue. People aren't in the mood to be told to do anything. But on the other hand, I think that we are now better equipped to do genomics, tracking the virus. And so in that way, I think we have a little bit of an advantage.
All right, Dr. Jeremy Faust, just what we need, another virus to worry about. Thank you so much for joining us. We appreciate it.
Sure. Thank you.